The difference between a nurse practitioner, which you can also be called an NP, FNP, adult nurse practitioner, versus a doctorate of nursing practice, which is the DNP, which is a doctorate degree. But a nurse practitioner is a nurse that goes back to school and get a master's degree and then takes state's boards in whatever specialty. That could be psychiatric nurse practitioner, it could be family nurse practitioner, adult nurse practitioner, pediatric nurse practitioner, but they have a master's degree and they to state boards to be certified in that. A doctorate of nurse practice is a doctorate degree. Yes, we are nurse practitioners. You get that after that. But the main difference in the clinical setting is that a DNP has learned the roles of more leadership and actually applying research from a PhD. So DNP doesn't quite do the research. We take research from a previous PhD student or PhD colleague and implement it into practice. It's been shown that when PhD students do their project, it's a great research, but it takes 15 years before it actually gets into practice. So the DNP was created to actually try to limit that to 5 years. So when the studies come in, that we're not delayed in implementing into practice. Because you can do a great study, but are we doing evidence-based in the facility? So as a family nurse practitioner, I use evidence-based just like any other clinical, even your doctors, your MDs, your DOs, we use evidence-based, and basically DNP fills the gap to do. DNPs do still see patients, but they are designed to go into some leadership roles to make and implement change in facilities to make them better. So that's pretty much it. Both are nurse practitioners. One just has a doctorate degree. So that NP, state board certified, DNP is a doctorate degree, and is designed for us to implement change in clinical practice.